I'm Dr. Suddaby, and it's my pleasure today to speak to you briefly about a new technique available to treat back pain. Back pain is a common problem, and about 80% of people experience back pain at some point in their life. In fact, it is the leading cause of disability for work and play for people worldwide. In the United States alone, back pain accounts for approximately $50 billion spent per year in treatment of this disorder. While most causes of back pain relate to degenerative disc disease, where the cushions between the bones break down and cause pain, or from lumbar strains, about 25% of cases of back pain occur where the spine itself joins onto the pelvis. So while most of the focus has been on the spine, a lot of people have neglected the sacroiliac joint, and it really is a major cause of disabling back pain. In the past, the treatment involved a major incision and curetting the joint with the packing of bone into the joint to cause it to fuse. This might take a couple of hours to do, and people might be in hospital for a few days. With present image-guided techniques, by melding computers with surgery, we have the ability now to use minimally invasive techniques to perform the same surgery in generally less than an hour, with patients going home the same day. Now remember, we talked about the fact that back pain is a real problem for humans, particularly because of their upright posture and the tendency for gravity to push down on their discs and also on the joints of the spine. That means that anything that you lift, anything that you carry, is carried by this major strut in your body, and those forces are transferred to your pelvic bones and ultimately to your hip joints and your legs. Consequently, any problems with the spine sometimes will stress these joints. These joints are a complex joint. They're a combination of a fibrous joint and a synovial joint. So they're allowed some movement, and generally normal movement is thought to be 2 to 4 millimeters, which is relatively insignificant compared to the other joints in the body. Having said that, if there is excess movement at these joints, it creates almost like a frictional condition, or it stresses ligaments, and it can cause severe pain. So to stabilize these joints, as we said in the past, a big incision was used, the joint was curetted out, and bone was packed in there, and then they were either instrumented with a bar across, or they were on bed rest to allow it to heal. The newer way of doing it is to use image guidance to allow us not only to see the joint, but also to see all of these openings where the nerves run so that we can avoid them. We can do one of two things to stabilize this joint, and we usually stabilize it in the minimally invasive thing with a little device that will go across the joint. So through the bone, either from a posterolateral point or from a lateral point. We'll move over here now to this diagram, and I'll show you here that a posterolateral approach allows you to go across the joint and stabilize it, but avoid most of the musculature. So we're on the back of the spine here of the iliac crest, and that's called the dimple of Venus. So on that point, there's very little musculature in the way, and you can make small openings to allow this device to be placed across the joint. You can also approach it, and some people prefer this for various reasons, but you can go across the muscle, and you simply use dilators to spread the muscle, and then the device is placed in a lateral position. If we look at the spine here, you see that there are two joints, one on either side. So sometimes you need either one done or both done, depending on the pain. And the way that the diagnosis is made is by simply injecting a local anesthetic into the joint. So if you had this kind of pain, your doctor would want to inject the joint, and if you got relief of pain, then that's a pretty good idea that that's the cause. If this is relieved by local anesthetic, then you have this joint dysfunction, and you would be a candidate, failing therapy and other conservative measures, for approximately 3 to 6 months. You would then be a candidate to have a device such as this placed across the joint to stabilize it. These devices are often placed in 2 or 3 locations to fix the joint, because it's a rather long joint that goes along the upper part of the sacrum and joins it to the pelvic bone or the ilium. so that by putting more than one across, you prevent any kind of rotatory movement which you're trying to stop. The other beauty of this device is that it is self-drilling, self-filling, meaning as it goes in, it draws bone into the substance of the device so that you do not have to add any bone to the device once it's in position to allow it to heal. But the device itself is designed to be implanted in a minimally invasive fashion across the joint, and it harvests its own bone while it's going in. So you have the benefit of no additional bone, you're using your own bone, and the device can be filling itself simultaneous to being implanted. In summary then, I'd like to take this moment to thank you on behalf of the General Physicians PC and Erie County Medical Center to display this technology and this novel way of treating a problem that faces people regarding back pain. A simple device such as this can go a long way to be implanted in a minimally invasive fashion for their entire life. Thank you.